Good afternoon. We see all of you coming into the webinar, so welcome. We're glad that you can join us on the state's response to COVID-19 and child care, part 2 in our series. We hope that you were able to join us last week, but if you weren't, we have some dynamite presenters for you today. This session is being recorded, so we invite you to join in freely, ask questions, and also know that you will receive the handouts and the recording later. Also, the recording will live on our COVID-19 resources website at childcareaware.org, where all of our other webinars and resources are as well. To ask questions today, we invite you to use the question box that is right on your screen. We will try to get to as many questions as we can during this webinar, but we will also compile questions later if we aren't able to answer all of them and try to get some of the answers back out to you in a later email. My name is Kiami Harris. I'm the Director of Learning and Events here at Child Care Aware of America. And today we're going to hear from 3 presenters from Colorado and Indiana. We'll have questions and answers, and then we'll close it out right at the end with a few announcements, so we hope that you will stay on. I want to introduce to you Child Care Aware of America's Executive Director, Lynette Fraga, who began her career in early childhood as a teacher in infant, toddler, and preschool classrooms. She's held positions in local, state, and on the national level within nonprofit, corporate, and higher education sectors. She earned her doctoral degree in family studies from Kansas State University. She has a master's degree in human relations from the University of Oklahoma and a bachelor's degree in special education from the University of Arizona. Now I'd like to turn it over to Lynette.
Thank you, Kiami, so very much. And hello, and thanks to everyone for joining us today for the second part of this webinar series about how states are responding to the coronavirus pandemic. A major challenge we are facing is that state needs, and by extension, state policies and approaches, are all over the map. For example, as of today, because things are changing very, very quickly, one state, Rhode Island, has completely closed childcare, while 21 states are only providing care for essential workers, and the balance of the states have allowed childcare providers to remain open. So today we're going to take a look at 2 states, Colorado and Indiana, that have been very focused on supporting childcare during this pandemic and can serve, I believe, as models for other states. I'm so pleased to welcome 3 dynamic childcare leaders from Colorado. Taryn, who is also on our Child Care Aware of America board, I do have to say, and Indiana as well with us today. I'd like to turn it back over to Kiami to introduce them. And thank you so much again for joining us and for everything that each and every one of you are doing to focus on our children and families during such a challenging time, I know, for all of us. And our thoughts are with each and every one of you as well and your families and communities. So with that, Kiami.
Thank you, Lynette. So we have 3 amazing presenters, as I mentioned before, and as Lynette also highlighted. Taryn Snyder is the Executive Director of Healthy Childcare Colorado, a nonprofit that builds safe, supportive, and healthy early childhood settings and systems where children and professionals learn and grow. Taryn has held a variety of positions in the early childhood sector, from being a teacher in a toddler classroom, to coaching early childhood programs, to coordinating comprehensive systems such as child care health consultation and child care resource and referral. She has worked to ensure that the services of these systems are recognized and valuable resources in communities. Taryn holds an associate degree in child development and a bachelor's degree in professional leadership from Winona State University. She also holds a master's degree in administrative leadership and policy studies from the University of Colorado. Additionally, as Lynette mentioned, she serves on the board of Child Care Aware of America and has completed a CARE fellowship, the Collaborative Leadership Fellowship, and the Buell Early Childhood Leadership Program. Our next presenter is Bill Jaeger, who serves as the Vice President of Early Childhood and Policy Initiatives at the Colorado Children's Campaign, a nonprofit, nonpartisan research, policy, and advocacy organization committed to ensuring every chance for every child. Bill has spent nearly 20 years teaching, studying, and working on issues in public education and public policy. His research has been published in American Politics Research and State Politics and Policy Quarterly, and he currently serves as a Colorado Children and Families Health and Human Services Ascend Fellow with the Aspen Institute. He also serves on the boards of the Colorado Children's Immunization Coalition and Mile High Early Learning. At the Children's Campaign, Bill has led efforts to advance childcare, early learning, mental health policy, efforts for the Colorado's youngest children. Bill is a graduate of the Cheyenne Mountain High School in Colorado and enjoys spending his free time in the mountains with his wife, son, and daughter, and golden retriever. And finally, we have Maureen Weber, who serves as the president and CEO of Early Learning Indiana, which he joined in 2018. Prior to that, Maureen spent her career working across multiple sectors with an emphasis on human capital development and education to improve the way organizations meet the needs of the individuals they serve. Maureen has served in senior leadership roles for a national education nonprofit and for Indiana's largest healthcare system following several years in state government. I'm going to turn it over now to Bill.
Thank you, Kiami. And I think we can go ahead and advance the slides to our first slide on Colorado. Thank you. Before beginning, I just want to express my appreciation and the appreciation of the folks here in Colorado for all that Child Care Aware of America is doing to provide resources and supports. I think you all are providing a great balance of policy-focused conversation as well as practical implementation strategies. And I just really appreciate all of the ways that our federal partners and national advocates are telling the story of states to our members of Congress as they contemplate their next steps on federal stimulus. At the Children's Campaign, we've been engaged in child care policy since our founding and in 1985, and I think it goes without saying that these are sort of unprecedented times for the work we're all trying to do to address this challenge. I think that one of the reasons that the team wanted to include us in some of this conversation today was because of some of the things that Colorado's doing in terms of our emergency child care response. So I have 2 slides, and then Taryn will go into more depth on the ways that Healthy Child Care Colorado's providing direct supports to providers in the community when she gets to her section. But I thought it might be helpful to begin with some of the specifics on the systems and policies that we are looking at and trying to address. So just to begin, Colorado moved very quickly when the pandemic's impacts on families and our workforce began to emerge. And we worked really quickly to stand up an emergency child care response. And so I thought it might be helpful to speak to kind of what some of that might look like and where we are today. So on March 15th, which for Colorado was pretty early into what was beginning to happen here in the state, the governor called a number of partners, including the Colorado Department of Human Services, which oversees our Office of Early Childhood, including child care licensing, Gary Community Investments, which is a philanthropic leader in the state in early childhood systems, policy, and direct service, our organization, the Colorado Children's Campaign, and pulled in also a private sector technology company, Nano, who is an existing entity that matches families seeking care with care arrangements in sort of a technology on-demand way. And then numerous other community-based organizations, including early childhood councils, which 16 of which of our 34 are our child care resource and referral entities at the local level. Healthy Childcare Colorado, our leaders on sort of health and safety practices in childcare settings. They coordinate our childcare health consultants, and Taryn will offer more detail on what they do to really sort of think about how we could very rapidly stand up an emergency childcare response. I think a few of the sort of features that became really important to partners, advocates, and leadership at both the Department of Human Services and in the governor's office was, as quickly as possible, moving to as an inclusive definition of an essential workforce as possible. We began in sort of phase one, we'll talk about, around the most pressing needs that were emerging as they related to our healthcare workforce, our first responders, and our caregivers for individuals at long-term care, mental health, and residential facilities. But that definition of essential workforce expanded very quickly to be much more inclusive, including of our early care and education professionals themselves. I think another sort of principle at the outset was making sure that we were utilizing existing voluntary licensed capacity rather than standing up new or unproven or unlicensed models to respond to the childcare needs of the essential workforce. And the last sort of key feature was recognizing that payment rates needed to be based on a cost of quality that included higher pay for teachers and smaller ratios and group sizes than normal childcare licensing requirements. So in a very rapid way, with the governor saying we needed this response available as soon as possible, within 7 days, childcare was launched to respond to the care needs of that first phase of emergency healthcare and caregivers at long-term care, mental health, and residential facilities. And because we were able to, this was prior to any sort of clear picture of what a federal stimulus would look like that would or would not include resources to support some of the emergency childcare response, we were able to identify some of our existing child care and development block grant funds, as well as receive philanthropic support from the Buell Foundation, which is a longstanding early care and education funder in Colorado, and Centura Health, which is a healthcare provider, including operates a couple of hospitals here in Colorado, who really saw this need emerging for their healthcare workforce. And so committed to 2 weeks of free care right from the outset for those folks deemed essential in that first phase. And then at the same time, sort of built a parallel track around how we would move to the type of care arrangements when we looked at the length of the pandemic. And so we are now, as of April 1st, committed to a total of at least 8 weeks of free care for all essential members of our workforce. And that would include sanitation, critical construction, food service, including grocery workers, agricultural workers. So a broad and inclusive definition of who is deemed essential, and made that commitment to those 8 weeks of free care at those rates that reflect a need for higher pay, smaller ratios, and group sizes. I think another feature that might be of interest to folks is the partnership with the private sector technology firm Nano. It's a very small operation. I think they have 2 or 3 employees, but very quickly we're able to deploy their technology platform to better capture what demand was looking like, and implementing algorithms to very quickly match demand to providers who wanted to be part of the emergency childcare response. I think that as that has rolled out, we've now iterated to where State agencies sort of better managing the intake and demand and the connection. But it was a really great feature at the outset because we captured a really clear picture in that first week to 10 days of what demand was going to look like. And I think it's worth noting that because our K-12 schools were closed, about 55% in that first 2 weeks of requests for care was for school age care. About 20-something% for preschool, another 18 to 20% for toddlers, and about 7% or so for infant care. So I think that allowed for a more intentional focus on what did the supply building strategy need to look like. And that included really looking to our school age providers, our partnerships with Parks and Recreation. As I said, our YMCA has been champions throughout this process, our Boys and Girls Clubs, and a number of other sort of standalone school age providers who, again, the intent was not to stand up or dilute staff requirements, protections for health and safety. And in fact, we have additional protocols that our Department of Public Health and Environment and then our local public health professionals have helped providers implement. And I think Taryn will speak more to some of what those supports look like. As of earlier this week, we are at about 4,500 applicants for emergency childcare and more than 20,000 slots identified. So supply is far outstripping demand to date. We'll see as demand might iterate over time, but our provider community has really stepped forward to be part of this response. We can go ahead to the next slide. So I think that gives a sense of what the emergency childcare response has been. I would also note there's been a lot of partnership and advocacy around our childcare subsidy program in particular, and ongoing advocacy that look beyond and think bigger than the emergency response. So we are in Colorado a county administered childcare subsidy program, meaning that counties in Colorado, there are 64 of them, have discretion over certain elements of policy when it comes to various things. The state sets payment rates and parent copays, but counties have flexibility to waive various components of those, and counties, as long as they meet a floor when it comes to sort of absences payments. But I would say we very quickly put together an advocacy letter focused on enrollment-based payment policies, copay provisions for parents, and really trying to get resources out to the community-based providers. Now we see pretty quickly most counties are paying at least 20 or more absences a month, with the largest counties in the state, with the exception of just a couple, paying 31 absences per month, getting as close as our system technologically can allow to an enrollment-based model. We have ongoing advocacy focused on the emergency response needs. We are struggling in a few areas with access to supplies and the various supports. Taryn will talk about some of the ways they're helping troubleshoot those issues. We're very focused on strategies that can stabilize the sector and the best use of our federal stimulus funds. And I will say it's not enough. We know that that $3.5 billion in our Child Care and Development Block Grant increase for Colorado, CLASP estimates is about $41 million, and that is going to go quickly when we think about absence payments, copays, and standing up this sector more broadly. And we are looking at our legislature, who's been on recess, reconvening in early May, mid-May, and we are looking at substantial budget cuts, as I'm sure states are. So we are really looking to the federal response for the dollars needed to support our early care and education workforce and additional reforms in and outside of our subsidy program. Finally, I'll just conclude by saying we are beginning a conversation in the state about how do we pivot toward long-term structural reforms to the sector. We all know how this crisis has sort of revealed the fragility in really concerning ways and are very concerned about what the world will look like on the other side. But we are not going to let this crisis pass by without really promoting a overhaul in thinking about how we finance and support this sector. So I will hand it to Taryn and look forward to the conversation later on.
Wonderful, thanks, Bill. If you can move to the next slide. So I'm just going to give you a really quick overview of what Healthy Childcare Colorado does, and then I'll talk about some ways that we are responding to the COVID-19 pandemic and supporting providers and health consultants through this. So Healthy Childcare Colorado, our mission is to build safe, supportive, and healthy early childhood settings and systems where children and professionals learn and grow. And we focus on we have 4 focus areas that you can see on the screen here that are typically deployed in our work with childcare programs across the state and that we promote with health consultants. And really our role is sort of 3 things. We have 3 mission strategies that we work on. One is to serve as an effective hub for childcare health consultation across the state. The second is supporting quality improvement efforts in early childhood programs. And the third is around advocating for best practices and sound policies. And in order to do number 1 there, to serve as the state hub for health consultation, we have a long-standing partnership with Children's Hospital Colorado that's been in place for many years. And we work with a couple of RNs from their school health team, and they actually help provide some of the clinical support that we need for the childcare health consultants across our state, which the majority of them are registered nurses and some are pediatricians. So that's just a little background that might be useful. You can go to the next slide. And as Bill shared, the overview of the emergency childcare, we have seen that there is a significant demand for school age care, which isn't surprising because so many schools are out. But we are utilizing licensed programs to place those children in care, and are really focusing on helping some of the programs that are getting those provisional licenses. So for example, our Boys and Girls Clubs and things like that. We have had to expand some capacity for school age. And so at Healthy Childcare Colorado, we've been supporting those programs to ensure that they understand more of the licensing regulations and how they can find a child care health consultant in their area. They are required to have one. And so we've been doing a little bit more high touch support to ensure that they have connection with a health consultant in their area. So if you go to the next slide, the way that we're doing that matching is in our health hub. On our website, we have a health hub, which serves as a registry and a resource center for all of the health consultants in Colorado, of which there are just over 1,000 people serving in that role. And we have added a data field in our health hub profiles so that childcare health consultants can indicate if they're interested in providing health consultation services to emergency programs. And then we're able to do some matching with the providers who need to identify a health consultant, especially those programs that are getting a new license or obtaining a provisional license. Next slide. And then down into some more detail, I wanted to share a little bit with you all about what's happening in Colorado as far as some extensions and sort of temporary practices that are being put in place. We have an extension of 120 days for health appraisals, some training certificates. I'm sure most of you know the American Heart Association has extended their first aid and CPR certifications, and so Colorado is also allowing those extensions through our licensing team. And we've had to create some temporary guidance for our health consultants around teleconsultation. And I know that there are other people within our state who we are coordinating with to work on guidelines for coaching to happen in a teleconferencing way, as well as home visiting and early childhood mental health consultation. And so we have really leveraged kind of our partnership with Children's Hospital, who has a lot of experience in telehealth, to help us put together this guidance around teleconsultation and some best practices. So I'm happy to share that with you all, or show you where you can find it on our website. But that has been a big project that we worked on in the first 2 weeks of this, because our childcare programs still need to have their visits from their health consultants, but now they're being allowed to do those visits through teleconsultation. And so we quickly had to sort of stand up some guidance around how to do that and what platforms can be used and things like that. We've also been doing a lot of promotion of the exclusion guidelines in Colorado. We have How Sick is Too Sick is the exclusion guidelines that we work with the public health department to put together for childcare programs. And now those exclusion guidelines have been somewhat tightened with the pandemic. So if a child even has one symptom, they should need to be excluded, and same with staff. So we've been doing a lot of education around what the exclusion guidelines are now. You can go to the next slide. We've also been working on doing some huddles, which are really short meetings. And the purpose of a huddle is really to make sure that everyone has a way to plug in and get quickly informed and make sure that what we're doing is aligned. And so we've been doing huddles with childcare health consultants across the state once a month for the last year or so. And now we have stepped that up to be doing those once a week for health consultants and 2 times a week for early childhood providers. We have started doing huddles on all kinds of different topics. And you can kind of see listed here on the slide what some of those have been. We're really just basing it on what we hear in our technical assistance to sort of help us meet the need based on the questions that we're hearing quite a bit, or the needs. And we're really also trying to focus on, the mental health of the childcare providers themselves and making sure that we are providing sort of these mental health moments. We're trying to have at least one of our huddles each week be focused on mental health moments and how they can, identify ways to de-stress and just share how they're feeling and how they're dealing with everything. And so those have been a huge success. We've had over 300 people on some of our huddles, and those can be found at the link on the slide. And you can go to the next slide. We have also designed a childcare sustainability grant program to really help us try to retain the licensed childcare programs that we do have. As Bill said earlier, this has really highlighted how financially fragile our childcare programs are. A lot of us knew that, but this is really a chance for us to, put a highlight on that and figure out a way that we can make some systemic changes. But before those things happen, we need to make sure that these programs can remain in business, so that when we are ready to go back to some level of normalcy, that those programs are still there. And so we've put together a sustainability grant program, and we are currently working with a few funders to try to get this up and running. And this would be in addition to any federal support, including the small business loans and the Paycheck Protection and all of those things that are out there. So you can go to the next slide. And this will be my last slide. So I just want to highlight, one of the things that we've been reflecting on as a team at Healthy Child Care is that part of our DNA as an organization has always been about collaboration and approaching all of our work in a very collaborative way. And that therefore we have very strong relationships with a lot of our state agencies. And that has been a key to the response in this pandemic. We've been working so closely with them. And that has been so much easier because we already had that established relationship. So I can't highlight enough how important it is that we have these relationships across different sectors, so that when things like this happen, we can jump right into working on solutions in a bit of a quicker way, and already have that established trust and expertise, and sort of know how we can leverage each other. So I've just listed a few things that we've been doing mostly with the key partners there listed, the state agencies. We've been having daily huddles with them to talk about anything that is coming up related to this. This week, for example, we've been talking quite a bit about masks and face coverings, and if the childcare workforce should be using those, if children in childcare should be using those, and what some of the, trying to help our state interpret some of the CDC guidance and figure out how it's applicable to childcare settings. And so it's just been so valuable to have those relationships and be able to leverage them during this situation. So I'll stop there. And I do have one more slide if you want to go to the next one. And this is just a slide with links to key resources so that you all can go and look at some of this after these get sent out. These are things we've been promoting, and we've been really clear with our providers and health consultants about really sticking to resources that we know, including the CDC and our state health department and our state human services. There's a lot of information coming out from all over the place, and we're trying to sort of limit the amount of confusion out there. So we've been really highlighting these state and national resources with folks. So now I will turn it over to Maureen Weber from Indiana.
Thanks so much, everyone. I'm so excited to be spending this time with you and learning together as we're all going through this unprecedented situation for the first time. And I want to start just by echoing Bill's comments and thanks for the work of Child Care Aware of America. I think it's been really just instrumental in helping us stay abreast of what's happening across the country, to learn from other states. And we've many times already incorporate ideas that we've learned on these and related phone calls. So thank you for holding us all together as an industry. If you can advance the slide, I'll say just a word about Early Learning Indiana, the organization that I lead, for those of you who may not be familiar with it. We are wearing a number of hats in the current situation. We start by practicing what we teach. We are a provider. We operate 9 early learning centers in the Indianapolis area. 8 of those have remained open through these last weeks. One's located in a school and has had to close. We've closed 2 temporarily due to positive COVID-19 cases, which I think is an important part of my perspective in this as well. And then we've also popped up school-age care to support a healthcare provider with whom we work over the last couple of weeks. We also work to share what we know, working with providers throughout the state, in large part due to a generous grant that we received from the Lilly Endowment that's allowed us to support providers in improving quality and growing capacity in regular times. And we're working to understand what that means for these times. And then lastly, driving system level change. And I'm giving the Indiana update today, but certainly there are hundreds and hundreds of people who are deeply engaged in this work. Many of you I know are on this call. Our partners throughout the Child Care Resource and Referral Network, from Spark Learning Lab Indiana, the Indiana Association for the Education of Young Children, and certainly the state of Indiana as well. So I'm delighted to share a bit about what's happening across Indiana on behalf of all of those partners. We'll move ahead. So at the highest level on my next slide, thank you. You'll see that Indiana's response, like Colorado's, has been really focused on speed and agility, and I'll show some ways that we have already started to adjust even over this very short time horizon that we've been working through. Indiana's Office of Early Childhood and Out of School Learning responded really quickly, and I'll share some of the most important steps they have taken to provide guidance and funding to address the immediate needs, and then talk a little bit about how both the state and Early Learning Indiana and other partners have started to build connections and plan for the long run as we do that. I won't go through the detail of the regulatory guidance, as I know that it's similar to what's happening in many other states, but just so that you have a perspective of what's going on the ground in Indiana. I would note that the state initially, several days into our response, issued an order stating that childcare should remain open, followed several days later by further guidance indicating that we may remain open. And that initial shall provided an incredible amount of air cover for those of us who were scrambling to figure out how we would continue to serve essential personnel and others, gave our boards and others great comfort. And then as we all sort of settled in and understood a little bit more about what this would look like, that movement to May became more appropriate. But I think that initial order brought us plenty of time to think and plan. And so we were able to adjust and do things in our own centers, for example, like seeking permission to extend our birth to 5 care to school-age children for the sole purpose so that our own teachers could bring their children to work with them so that we could maintain our workforce. So I just really appreciate the way in which the state went about that. Moving ahead, then I'll say a little bit more about these other 3 buckets here, starting with the grant program that the Indiana Family and Social Services Administration has released. So on March 17th, please move ahead, that's perfect. On March 17th, the Indiana Office of Early Childhood and Out of School Learning released these temporary assistant grants to retain childcare. And similar to what's happened, I know, in a couple of other states, the state of Indiana leveraged CCDF and quality dollars to offer grant programs. And they did this really early on, just a couple of days after schools closed, and I'm so appreciative that they did. This program was really designed to support CCDF programs and help them maintain their workforce. And so more than anything else, they wanted to make sure that the childcare workforce didn't scatter to the 4 winds as a result of this. And so they initiated this program. It's a very streamlined process. It's issued in 2-week cycles. And so it really follows our subsidy payment cycle, and supports that loss of private pay tuition from private pay families that have been absent. I've got a couple of bullets in there around the responsive evolution. So we're all learning, and the state has already iterated several times on their process to make it smoother, both from a processing standpoint and from the point of view of the provider as well. And they've adjusted as other funding sources have become available. So for example, as the Federal Paycheck Protection Program came online, they've asked large providers to seek that funding first to extend the reach of their CDBG dollars. Moving ahead, I'll talk a little bit about then what we're doing to connect communities and families in need. And we've taken a couple of steps. And again, these were taken very early on. First, to figure out where are those places that were in need of community pop-ups who had a need, especially for school-age children with the closure of schools. And so in thinking about how we could connect those communities with the providers in their area that are already licensed to provide this care. And so we circulated a pretty lightweight, a simple interest form and received interest from more than 200 potential partners, and that included churches, community organizations, as well as providers themselves that wanted to participate in this kind of effort. And from there, we were able to connect those interested parties with our child care resource and referral agencies for additional one-on-one support. So that's been a helpful way to get things moving in Indiana. The next thing that we did was really to reach out to providers specifically and gauge who had an interest in continuing to provide care to essential personnel and others as well. And you'll see here on the left, we have more than 800 providers that responded. And so in relatively real time, we have a good understanding of the openings that we have. And another question that we asked at that time is, of those providers, who were in need of staffing, who had lost staff support as a result of some of the transitions underway. And so we've been able to respond as a result of that. The state's now moving to kind of take the next level down and connect that with demand side data, particularly from our medical field and healthcare workers. and then also to capture connection success rates. So right now we know that we're using these tools to help our child care resource and referral and our statewide support center answer family questions and respond to the need. We're going to be drilling down on how successful we've been and being able to connect those families with the support that they require. On the next slide then, that really led to this wonderful effort by our Family and Social Services Administration to launch what they're calling Hoosiers Serving Hoosiers. And really it's just a very simple way to allow Hoosiers to raise their hand and say that they have an interest, that they've been displaced or otherwise have availability and have an interest in supporting not just childcare, but also those with developmental disabilities as well as the elderly. And so this little job board, I think, will actually persist beyond the end of this current crisis and be a way of helping some of those hard to staff positions find each other. So we're really glad to be a part of that. And then the last thing I wanted to mention is we've really been focused then on what happens at the other side of this. And Colorado mentioned it. I know that many of you must be worried about that as well. So at Early Learning Indiana, one of the things that we've done is we're in the process of launching a Making the Most of It campaign. And we've done some things internally that may be useful to providers out there as well as externally as well. Internally, we've really used the time that none of us would have wanted, where census is low, and developed individual professional development plans and have done some of the things that it's hard for us to do in regular times. And so we have done a lot of cross collaboration across age groups and across our centers so that we're really trying to take advantage of the time, even though none of us wish that we had it. Externally then, the Making the Most of It campaign will involve a repurposing of some philanthropic support that we have received to enable those experienced child care workers who don't yet have a CDA to be able to pursue that online while they have either slow or perhaps no work, depending on what's going on in their community. And so we'll be making scholarships available then to all Hoosier providers who kind of meet our requirements, who want to pursue a CDA during this time. And then we'll be providing them with substantial portfolio support as they work through that process. So there are many more things to do. We know we are working every day to get a better handle on what the current needs of providers are. I know that one of the things that I've heard from several is the need for additional cleaning and sanitation supplies. And so our child care resource and referral organizations all across the state are gathering up grant and other opportunities to help individual child care providers stay connected with resources wherever they exist. And so we'll continue to make that kind of information available, and we'll think about what we need to do from a more systemic standpoint as well. At Early Learning Indiana, we're looking to develop a series of restart grants that will help providers have what they need to be back in the full swing and to make that challenging transition, as we will. From right now, we're serving about 100 students a day, and usually we're serving about 800 children a day. And so we know that others are out there facing a similar situation to us. So we are trying to do our best to tackle the current state across Indiana while also looking towards the future. So thanks for the chance to talk with you a little bit about it today. And I think I'll turn it over now for some questions.
Thank you, Maureen. Thank you, Taryn, and thank you, Bill. We are going to take some questions, but before we do, I just wanted to ask Bill if you would speak on any challenges that Colorado may have faced in standing up the emergency child care system and ensuring providers are licensed.
Yeah, you know, I was really moved by the response from our provider community. As I noted, we are up to a place where hundreds of providers have expressed a willingness to serve families of our essential workforce, reflecting more than 20,000 slots available. And so we, in general, I would say that math suggests that we as a community don't need to be looking to unlicensed or untested or unproven models to the extent that we're using childcare as part of our response to the need for care for the essential workforce. The one sort of caveat I would add is Colorado is a very diverse state geographically. And so we do have some communities where licensed capacity is not currently able to meet demand. And so that requires some thinking. As Tara noted, for example, our Boys and Girls Clubs right now are not licensed by the state. So it is a place where licensing has had to work quickly to provisionally license those providers who are offering care in those settings. I will also say, given the geographic size of Colorado and diversity, we rely heavily also on our local public health departments to make specific determinations about the provisions around the availability of care. And we have a couple of communities where local public health has gone above and beyond the state and is not permitting childcare providers to open their doors. And those are pretty small mountain communities where community spread has been particularly concerning. And so in those scenarios, we're still exploring, and that is one of the challenges, the alternatives to a licensed home or licensed center or licensed school age program in offering care to the essential workforce. I wouldn't say we have a solution yet, but we continue to talk about ways that we could create opportunities for individuals who otherwise might be teaching in childcare centers to offer care in the home of the essential worker who needs care. But the state is still working through, I think, the regulatory and financial sort of payment policy barriers to making that happen. So no solution in that scenario. But I think, again, the numbers sort of tell us that we have interest, capacity, and the ability to respond to most of the need in most communities with our licensed care system. And so we haven't largely run into that as an obstacle to the provision of care.
Thanks, Bill. I think you answered this, and I just want to make sure that I heard it right, because there was a question about the number of providers and capacity of slots pre-emergency in Colorado.
Yes. So, Taryn, you may know more about school age. I think my numbers are that prior to the emergency, licensed capacity for children under the age of 6 was about 150,000 slots. The school age capacity, I don't have as good line of sight on, and I would also point out even that school age capacity was largely for before and after school programs. So the YMCA, for example, being able to offer programs during the school day is something that they do in the summer. And so we've had some capacity there. And again, those school age programs partnering with school districts to use school district facilities where normally they offer after school programming or summer programming has not been an insurmountable obstacle to making sure that those who are offering the care are meeting core health and safety standards that licensing and additional sort of requirements by our public health have been able to require.
Thanks, Bill. This question is for Maureen. Are childcare centers and public school districts using playground equipment? I've not been able to find appropriate disinfectant for the equipment, and the provider insists on continuing use. The playgrounds are blocked off in the public. My concern is the length of time the virus lives on equipment.
Yeah, and I think that maybe by community, I know that in central Indiana in general, parks departments and school systems have closed off their playgrounds to use for the current time. And so if you want to follow up with me separately, I'm glad to research that issue and connect with you around it.
Awesome. I have another question for you, Maureen, while you're there. To clarify, are Indiana programs now offering, hold on, just lost it. Care to just children of essential workers or to any families?
They are to any families, but there's a prioritization for families with children of essential workers.
Okay, thank you. I have a question for you, Taryn. Can you share the website where you can find the exclusion information again?
Yeah, absolutely. And I believe you should be able to see it when the slides are shared as well, but it's on our Colorado Department of Public Health and Environment. If you just look up their website, and they have a COVID page immediately on the homepage, and you'll want to click on the guidance that is specific for schools and community-based settings, and that's where the childcare guidance around exclusions is.
Perfect. Bill, I have a question for you, and maybe Taryn, if you want to answer. What is Colorado specifically doing to help home providers, both those that have closed and those that have stayed open?
Yes, so home providers are part of the emergency child care collaborative response. So those are settings where parents can, or providers can raise their hand and say that they have capacity to serve children of essential workers. The second way is that providers who accept children with child care subsidy are benefiting from these policy changes around increased payment for absences to help keep those providers afloat. If you are in a situation where you're a home-based provider who does not accept subsidy, you're in a more difficult place where Colorado still has work to do to deploy capacity, resources, the federal stimulus to support the sector at large, including family child care as well. I think as of now, we have a number of associations and partners who've been helping those family child care providers connect to federal stimulus opportunities. We know that self-employed individuals are able to access the pandemic unemployment assistance program. And so we've been trying to encourage providers to apply for that as it becomes available as one of the best ways to try to keep themselves paid through the crisis. But as I noted, our legislature has been on recess. They're coming back in mid-May, and we are working frantically to try to get our arms around what the size of our actual federal stimulus appropriation is, how much it is getting stretched by the emergency child care response, the payment for absences, the co-payment reforms, to try to, again, advocate for additional investment to help support providers, home-based and center-based, to survive the crisis and be able to operate on the other end.
Great, thank you. And there was a comment, and it was been answered online, but I just wanted to share it out in case people are joining by phone. How do we get other states to offer grants and loans specific to child care? And one of our staff responded that that's a great question, and this is one of the reasons why we're having this series, is we're hoping that states will learn from each other. So thanks for that. I know that there have probably been others who have that same question and thought. Okay, I think we have gone through many of the questions, as many as we can, and I just want to take a moment to say a huge thank you to Colorado, Taryn and Bill, for sharing the great work that is happening in Colorado. We are really excited to see how you all have risen to the occasion and implemented policies and supports for childcare. And thank you, Maureen, for sharing the awesome work that is happening in Indiana as well. We know that this is not easy work, but we are so grateful for you all and all the work that you do. Everyone that is also on the call, we certainly appreciate you. I also want to invite you to visit the Child Care Aware of America website, where we have many resources related to COVID-19, as well as a state map that is also there that we invite you to take a look at. We post all of the upcoming webinars and any new information that we receive. As you know, things change rapidly, and so we invite you to visit often so that you can stay abreast of what is happening. I want to flag a webinar that we are holding on Monday at 3 p.m. That information will be coming out shortly, but since I have you all, I want to share that we will be doing a webinar in conjunction with the CDC. Again, that's Monday at 3 p.m. And then finally, want to invite you all to think about joining us as a part of our virtual symposium this year on May 4th. Our virtual symposium is going to be very different from what we typically do in our live in-person symposium. We'll be sharing more resources around COVID-19, as we know that life has changed significantly for many. So we invite you to join us to hear from many wonderful plenary speakers and experts in the field who will be presenting information that we know will be useful to your work. The link is live on our website at childcareawareofamerica.org. And again, we hope to see you on Monday for our joint webinar with the CDC. You all have a wonderful afternoon. Thank you for joining.